So I'm the Chief Information Officer for Well South. I lead a stream of work around telehealth. The theme around telehealth in the southern region is to give better healthcare access to the rural communities. Living in Dunedin, Dunedin, if you didn't know, is the 5th largest city in the world by geographic spread. Bit of useless information for some of you. And 40% of our practices actually reside in rural areas as well. And if you thought there was a lot of acronyms in IT, well, you might as well double that for healthcare. So about better access, I spoke to a doctor friend of mine, and I told him about this journey of telehealth in New Zealand, and I was embarking on this journey a year and a half ago and having a conversation with him, and his comment to me was, why not just use Skype, which is quite flippant. And I sort of sat back for a while and thought, well, you'd knocked me off my high horse for a minute, and then I thought, probably the same reason I don't use Google to self-diagnose. And he goes, yes, very good point. A survey was done by the New Zealand College of GPs around the practitioners, and a majority of those practitioners, I'll let you read that yourselves, but the theme around it is that the baby boomers who are GPs today are on their way out in retirement, and we don't have that same population of GPs coming out of med school and going directly into their communities. They're either going overseas or they're going up north, especially in the Southern District. And a lot of those baby boomers will be retiring in the next 10 years. The gaps that they expect are between 15 and 35% shortage in GPs. So we introduced a project around telehealth and delivering telehealth services to our rural practices. And I'll talk about the technology slightly, I'll briefly go over it. The technology we use is from Video. It is a software-based platform that we host ourselves. It isn't dependent on high bandwidth, and it can tolerate with some high latency in some respect. We did a project in Lawrence Medical Centre, and that was out of need. Their GP was actually retiring. They had no GP to replace for that community, so they could either send them to Roxburgh, Milton, or Roxburgh on the other side. And for some of the elderly people and people that are working on farms, that wasn't really tolerable. We did 14 consultations for the day, ranging between elderly and children. We got consent from each individual patient to undertake that, and that was a very wide group of participants within that demographic. The first case that we actually had was unscheduled. I was actually wheeling Dr. Keith Abbott around to position him into the room, and then a nurse came flying through the doors and said that a guy's come in with extreme stomach pain. Keith was able to diagnose him on the spot and said, I think you need to go to hospital because I think you've got appendicitis. And sure enough, that's exactly what happened. So it was a pretty good outcome from our first case, which was relatively ad hoc. This is just a picture of, this is out of New Zealand Doctor. This is the technology. So this was the doctor's end. He could see the consultation room there, and he also had the patient management system on the other screen. He could also broadcast that patient management system back to the patient so they can actually see, because if you're sitting in the consult room, you can always see your records and what's going on there. Not that you'd understand half of it anyway, because I don't understand half of it. But then you can see the doctor, and that's me taking a picture of the picture. And this is actually what the patient would see in the consultation room at Lawrence Hospital as well. I guess the idea around this is to be able to provide better access to services that aren't currently available to rural sectors or rural centres, and around dermatology, which is it's like hen's teeth, getting a specialist for that, mental health, elderly, and diabetes, treating chronic conditions around diabetes as well. The feedback out of that trial, by the way, we didn't have any stamps, and one of the children was crying because we didn't have a stamp, so we had to rush and get one. And the second piece of feedback that we actually got was we didn't have any lollipops either. So I think that was a pretty good result out of that trial. Next steps for us. So we're in discussions with Spark Digital up in Auckland, Dimension Data and Vivid Solutions around interconnectivity into our platform. We're relatively agnostic, so we can actually connect any SIP connection in a secure manner over an encrypted connection. but we are facilitating some discussions, and we're actually trialling with Vivid Solutions. Already done it with Spark Digital, and it was successful, and Vivid Solutions is currently underway now. And that's really important because majority of the South Island is connected into secondary care, which is the DHBs, and they use Vivid Solutions as that connectivity option for video conferencing. So it's important that we actually get that interconnectivity and interoperability right. Around rolling out telehealth, it's very important to get champions across the network, and what I mean by that is actually getting, if you're going to have specialists involved, get involved with the DHB and get the right people involved in the conversation. Don't isolate yourselves. We've got a few locations you can see in green there, and those are where the sites are. We've actually got some Lady Marie from Dunstan Hospital. We've just deployed one, and great supporter. And getting some quick wins through this as well. So Roxburgh is a really good example of that. So often, more often than not, we'll send someone to Dunstan Hospital, and we find that Dunstan Hospital can't actually treat them, so they then get choppered or sent via automobile to Dunedin Hospital. So around the cost of actually doing that, the telehealth infrastructure for that region would be paid within a month, so you can understand the costs associated with that. And the other quick ones is around specialist follow-up appointments. So if someone's living in Cromwell, they have to drive all the way to Dunedin for a 10-minute appointment and then drive the way back. So for a 10-minute appointment, they may, if they're elderly, they may actually get their family member to take the day off work as well and drive them to Dunedin and back again. For a 10-minute appointment. So that's a 5-hour round trip. So we're trying to eliminate all that stuff in the rural sector. Next steps also is around distance learning for rural communities in the medical industry, so that they don't have to travel to Dunedin or Invercargill or main centres for the delivery of services. And that's been facilitated and partnering with the likes of Mobile Health, who Mark is here with, who are the experts in that area, and connecting to them to be able to facilitate that. Also healthcare into the home, as telemonitoring is going to become more and more prevalent, and getting better access into the home, especially for the elderly, so that we're not getting those readmissions into hospitals. And the future is, and this is actually happening overseas now, is around having capsules where people go in and there's a doctor on the other end, and you can see all the equipment there, taking blood pressure, taking temperatures and all those sorts of things. I'm just going to finish off on one thing around connectivity, because this is a connectivity conference, right? Not a health conference. But one thing I will mention, I'm really close to getting connectivity. We have our own wide area network, delivering connected health across that on VLAN. Some will understand what that means, so that they can access things like e-referrals, etc. But if I'm going to give some advice to people that, especially in rural communities, and this is no fault of Chorus or anyone else, it's more around knowledge, and I've got a lot of knowledge working with Spark Digital in the past around wide area networks, and it's been, I guess, pushing the boundaries around connectivity. I'll give you an example. So we had a rural medical practice were quoted $120,000 to deliver fibre, and it was running outside their door, and I know technically you can't just cut into it. However, if I turn 45 degrees, I could see there's a new subdivision next door. Now, anyone knows they're not going to deliver copper to a new subdivision, they're going to deliver fibre. So that bill went from 120 down to 11, down to business as usual, UFB. So, and that's because we pushed and pushed and pushed. And it's no fault of Chorus. They're sitting in an office with a broadband map until you actually point it out and take photos for them and all those sorts of things. So if I can actually offer some advice for people that are struggling to get connectivity in rural areas, it's to push the boundaries and don't stop until you get it. Thank you.